Yes, 25 seconds more. Go. Good morning, viewers. It's a beautiful Saturday morning here, and we are here on Ask the Pediatrician Live. With me this morning is Dr. Gbemisola Boyede. We'll be discussing this big topic, malaria in children. Dr. Gbemisola Boyede is a consultant pediatrician, and she is the CEO of Ask the Pediatrician. I'm pleased to have you here with me, Dr. Gbemisola Boyede. You're welcome.
Yeah, good morning, Busayo. Thank you so much. Good morning, viewers. Thank you so much for joining us on Ask the Pediatricians Live this morning as we discuss this important topic on malaria. It's my pleasure to be here. Thank you.
Thank you. Doctor, we want you to expatiate so much on malaria. Malaria is very common in Nigeria, and it's a word associated to every sort of illness, especially in children. If a child is having fever, if there is anything wrong, it's malaria. What really is malaria? When can we say children have malaria? We want you to please explain to us.
Okay, thank you so much, Busayo. Before we continue, I'll just encourage all our viewers, kindly share this video, because I know there are many mothers that really need to know about this topic today.
Yes.
So just share to your friends, share to all the family members, or you can just call them to come and join you as we talk about malaria. Thank you very much. And now about malaria. So most of our viewers are from Lagos, Nigeria, according to Facebook. So, and most early African continent. So, Nigeria and most of Africa is malaria endemic. So, we have a lot of incidents of malaria. We have it happening all year round. There are some countries that are called malaria-free countries, but we in Nigeria and most of West Africa and other African countries still have a lot of malaria. And what is malaria? Malaria is a disease, it's an infection due to what we call malaria parasites, which enters into the bloodstream. And this malaria parasite, which we call Plasmodium falciparum, is usually spread through mosquito bites. So when children, adults, anyone who has the Plasmodium falciparum inside their blood is bitten by a mosquito, then if that mosquito bites another person, it will inject that parasite into the blood of the next person, and that will now begin to multiply. And they usually favor to go into the red blood cells, and when they go into the red blood cells, they multiply inside, and then they will destroy that red blood cells, releasing a lot of things into the blood that will now lead to the child having fever, rigor. And basically that is what malaria is all about. And it's a very serious disease because it can sometimes lead to, apart from the acute illness of malaria, there are other complications that can happen with malaria. If it gets to the brain, for example, it can cause what we call cerebral malaria and all that. And the blood of that child will be low, leading to what we call anemia and so many other complications. And in fact, that kind of malaria is usually in children, especially children who are below 5 years of age. And that is why it's important that we discuss malaria in children, because children and pregnant women especially, and some category of people are prone to having what we call the severe kind of malaria. And it's important that we don't allow it to get to that point before we start dealing with it. So I think I will stop there in terms of the introduction about why we need to know about malaria.
Yes, but like myself, I have questions, and I'm sure other mothers have questions as well as regards malaria. One is, if children have mosquito bites, does that mean they automatically have malaria? Should we start medication?
No. Okay, thank you so much, Josiah, because that's a very important question. Mother asks me all the time that immediately their children they immediately they wake up and see mosquito bites, then they ask, should I go and just start anti-malaria? No. The answer is no. Because like I
Okay.
said, you can have mosquito bites without necessarily having the transmission of that malaria parasite into your blood. So it is
Okay.
not every mosquito that is carrying
Right.
malaria parasites in them. So for a mosquito to bite to lead to malaria, it means that mosquito must have bitten somebody who already has malaria or has
All
the
right.
malaria parasite in their blood,
Then
and they
pass
now
it
beat
on.
you who doesn't have malaria parasite, then introduce that parasite into your bloodstream. So you could have mosquito bites if there is no introduction of
For its transmission.
malaria parasite into your blood, you are not going to have malaria. And because some of us in Africa, we are also beginning to develop, we have what we call partial immunity to malaria because our body has been producing some antibodies, though it's not perfectly effective to prevent the malaria, but it helps us not to always have malaria all the time whenever we are bitten by mosquitoes. So it's not every bite that will leads to malaria disease itself, but you should wait until there are symptoms of malaria and also confirm the diagnosis of malaria before you treat malaria because that's another challenge we are having. People just treat malaria once they have fever, even
Randomly.
because the weather is hot and their body is hot, they will think it's malaria and they will start treating. And what that has been leading to is the fact that we are now developing a lot of resistance. I mean, if you remember, most of us grew up taking chloroquine for treating
Yes.
malaria. But
Yes, doctor.
nobody is going to give you chloroquine anymore for treating malaria because chloroquine resistance is quite high to malaria now. So we are resting the medication. So when we use drugs indiscriminately when we are not supposed to use them, then we are going to end up having what we call drug resistance. Those parasites will develop resistance to those medications. And in that process, that will now lead to those drugs being ineffective. So what we are preaching nowadays is that you wait until you have symptoms of malaria and also possibly confirm it with a laboratory test. So we now have what we call the rapid malaria tests that you
Test,
can
yes.
easily do. Yes, anybody can do it. You don't need to be a lab scientist. And once this is confirmed that there's malaria, then you can now be treated for malaria. So we are walking away from all this. Any fever, just start anti-malaria because we end up with a lot of drug resistance.
Thank you, Ma. Viewers, please share this video so that others can also benefit from this discussion as Doctor is started answering or taking in our questions. Doctor, I would like to ask again, uh, is it possible a child have recurrent malaria? Because or for example, on the ATP group, we find members asking questions of recurrent malaria. Is it that they are not doing the right thing, or what could be wrong?
Okay, so to answer that question, you need to understand the life cycle of the malaria parasite or how things work.
Okay.
So I don't want to bore us with all the jargons, but basically there's
The
a
jargons.
life cycle of the malaria parasite itself. So it
Yes.
takes about, and depending on the kind of malaria parasite, we have different types. We have the Plasmodium falciparum, which is the commonest one, which we all have in Africa here, and then you have the other one, Plasmodium vivax, and the rest of them, which are not so common. Now, for the Plasmodium falciparum, its life cycle is about 9 to 14 days. So, in other words, if you are bitten by the mosquito, it will take at least nine. There's an incubation period where the parasites will get
Okay.
transform into the you understand. I don't want
Okay.
to be using medical jargon, but basically it will take you like up to like 2 weeks for to have the full blown malaria and all that. So what that means is that if a child has malaria now, unless that child is bitten by mosquito again, the child should not have malaria again within 2 weeks. You understand what I'm saying?
Okay.
But it's, yeah, so it is not every, but it means a child can also have malaria, let's say every 2 weeks. If the child is bitten again by another mosquito that carries that Plasmodium
Imodium.
falciparum, yeah, the parasite, the malaria parasite, yes, so that child can still have uh, malaria
Malaria
again. So you
again.
can have malaria twice in a month. That's about
Wow.
the average you should have. It shouldn't be more than that. So you can't have malaria every week. You can't, because it's like I said, the life cycle of the malaria parasite is about 9 to 14 days. Okay,
Okay.
and that means you are also getting exposed to the mosquitoes carrying the malaria parasite. So we're still going to talk about prevention, which is very key. If you work on prevention, then you should not be having malaria recurrently. And I know mother will say some people are prone to having malaria. Some say some people with
I
blood
just
group
want to
A
talk about.
or AA and stuff like that,
Good.
they are prone to having malaria and all that. But if even no matter your blood group or whatever your
Genotype.
status, if you are not exposed to the mosquitoes carrying malaria parasite, then you are not going to have malaria. So we need to work more on prevention, and I think I would like to talk a lot more about that later
Please.
on, how we can prevent
Okay.
malaria, especially for children, because that is very, very key. It is very, very key because, like I said, children are not yet having that kind of partial immunity against malaria that most of us adults who have lived long in malaria endemic area have. So because of that, children under 5 tend to have severe malaria when they do have malaria. And that is why it's important that we prevent children from having malaria rather than just wasting to treat them uh, for malaria.
Thank you, doctor. You made mention about some people being prone to malaria. I actually have wanted to ask about that, but you said prevention takes care of it. But I would still like to ask. Um, I know some people of genotype AA are more prone to malaria than AS. Does it have anything to do with the parasites, the malaria parasite?
Well, I would not really want us to go into
Okay.
the
We'll leave
deep
that for the
medical
doctors
stuff
when we.
behind that. Yeah, but it's about the red blood cells and because malaria usually attack red blood cells.
Cells.
You understand? And so some red blood cells, some kind of genotype make it easier for the malaria. So for example, people who have SS genotype, the sickle cell anemia, they tend to have more severe malaria. In fact, we prevent malaria very, very we are very aggressive with preventing malaria in people who have sickle cell anemia because they are more prone to having malaria, and it break down the red blood cell faster, and it leads to crisis and stuff like that. So it has to do with the red blood cells, and because of the red blood cells has the hemoglobin, that is what determines your hemoglobin genotype and stuff like that. So basically it has to do with that. So I think our viewers can ask their questions. I can't see
Yes.
anybody asking
Please let your
questions. So
questions
let's
keep
have our
coming
questions so that
so
we
doctor
can address them
can
as
explain
well.
more and educate us more on that. Let's have your questions coming. Please share the videos round so that others can also be a part of this discussion. I also have to ask you, what preventive method can we have to guard against malaria?
Yeah. Okay, thank you so much, Busayo. So, preventing malaria, there are many ways to prevent malaria. Number one is to prevent the mosquito bites. It's very, very important. So, in other words, we want to avoid mosquito bites for the children because, like I've said at the introduction part, if there's no mosquito bites, then there'll be no malaria because malaria is transmitted through
Through
mosquitoes.
buying.
So how do we prevent? Yes, how do we prevent those mosquito bites? It's also to get rid of the mosquitoes from our house. That is where to begin from. So you want to keep your environment clean. no bushes, or you cut them regularly, clear off the gutter. Sometimes you need to fumigate the house and things like that. We don't want all these containers everywhere with little water, stagnant water, because that is where those malaria parasite, that's where they multiply, and mosquitoes, sorry, insecticide treated nets. This long lasting insecticide treated nets, it's a net. In other words, it prevents mosquito from entering, but it also now has insecticide impregnated into the net in a way that when the mosquitoes land on the net, it kills them off. And it also protects every member of the family. So we always recommend that pregnant women and all children sleep under long-lasting insecticide nets, and it's readily available. In fact, there are times that the government was sharing them for free, but you can easily buy them in most stores. Just just make sure you spread them around. And sometimes that's another method of preventing malaria. And sometimes when you have to take children out, because most of the bites are common in the late evenings stroke early morning. So you want to wear them long protective clothing, things that will cover their hands and their face and things like that. So it will also reduce mosquito bite. But sometimes you just have to be outdoors, and of course you can't put nets
Help it.
around you when you are
Yes.
outdoors and all that. So sometimes um, for the older children, they can use some of these mosquito repellent sprays and stuff like that.
All
Yeah,
right.
but the most effective is when they sleep under insecticide treated nets. Before we used to talk about what we call prophylactic anti-malaria treatments. I'm sure most of us grew up in the days of Sunday
Sunday
medicine and things
dressing.
like that.
Yes.
Yeah, but we've moved away from that now, so we don't recommend any treatment, any prophylactic drug. We don't recommend Daraprim or any of those Sunday medicine anymore. And the reason why we stopped doing that is because, like I said, we want the children to also develop some immunity.
Immunity.
It's not total immunity, but it's some partial immunity. And the only way they can develop it is when they get exposed to malaria as well. So we don't want to completely overprotect them. Because of that, we don't give medication to prevent malaria anymore. We give to the pregnant women. We do what we call uh, intermittent presumptive treatment of malaria for pregnant women. But initially, people were also recommending we should do for children, but that has not been approved because of that. So we should not give drugs to treat children, and you don't need to treat your children for malaria like every 3 months, because I see some others who ask questions like that. That okay, so I
Yes.
will just treat them intermittently every 3 months for malaria. No, we shouldn't do that. It's not
Thank you very much.
recommended.
We have questions coming in already. We have a question from Becky Ajayi. She asked, how often should you take a child for malaria test?
Okay, thank you, Becky. You don't need to take a child for malaria test if the child doesn't have malaria. So it is not something you should just go and do like you are doing your blood group or your genotype. No, you don't have to. So wait for the child to have malaria. If you think the child has malaria, how do you think the child has malaria? The child may have fever, they may have they may have poor appetite, they may be vomiting, they will just be unwell. Sometimes children are just unwell. So in that instance, what you need to do, take the child to the hospital. I also don't encourage mothers taking their children just to the lab to go and do tests and things like that. Take the child to the hospital, because there are many things that may look like malaria, like we discussed last week about fever. Fever is just malaria is just one number anyway, negative.
Thank you. Another question I would like to ask is it possible a child will not have malaria in a whole year?
It is possible for a child never to have malaria, yes.
Wow.
And there are people that live in malaria endemic area who have never had malaria. So it is not compulsory you need to have malaria. And in fact, there is a time we're having this episode of people who live in Lekki and all those Ikoyi area, posh area in Lagos, where they are not exposed, they are so protected, they're not exposed to malaria as such. And then when the children now went to boarding school, then they have malaria for the first time in their life. They actually come down what is called severe malaria, because they are more or less like the people from malaria-free environment. So I'm just trying to say that it's possible for you to have malaria it's possible for you never to have malaria if you are not bitten by mosquito. It's just that because we live in a malaria endemic area. It's quite common. Yeah, that is why we have malaria all the time.
Thank you. We have another question coming from Joanne. She asks, is stooling a symptom of malaria?
Yeah, thank you, Joanne. See, malaria is one condition that anything is possible. Virtually anything can be part of malaria. So stooling can be a symptom of malaria, vomiting, even cough. People think cough is just something infection. No, you can have malaria. Because malaria is because it's a condition, it's an infection with the blood. And remember, your blood goes around the whole body. So virtually all the become malaria, being unwell, and things like that. So, but otherwise, you can have virtually any symptom in malaria. And there are some people that don't even have fever when they have malaria. That's another thing. So if you are just feeling unwell and all that, you may just want to even go to the hospital. And most doctors in this part of the world, because knowing that malaria is very
She had. Good morning, doctor. Please, can I give my 2 years who has never been treated for malaria and anti-malaria medicine? I think you've answered that.
Okay, so Maya,
you talked about that.
We've answered that already. Please do not treat your child for malaria if the child does not have malaria, or wait until the child has malaria before you treat malaria. And that malaria even have to be confirmed by lab tests before you start treating the child. So don't treat your child without the child having malaria, confirmed malaria, because you are going to end up increasing the chances of malaria resistance medications. Yes, yeah, we're going to have a lot of medications who are now going to be resistant to the malaria parasites.
Thank you, doctor. We want to go on commercial break now. When we are back, we'll take more questions.
Take down malaria with Latacen. Latacen anti-malaria is absorbed quickly by the body, allowing it to fight the malaria parasite straight away and get you back on your feet in no time. Also available in drops and suspension. Please consult your doctor if symptoms persist. Latacen anti-malaria, another quality product of Africhem Limited.
Being a great mom isn't just about playing with your kids or providing toys for them. It's also about knowing when they're not feeling well and the medicine that's right for them. When my daughter has a fever, I give her Panda paracetamol drops, specially designed for the relief of pains and feverish conditions in infants and children. It's very gentle on my daughter's stomach and body so that she gets stronger and healthier. With Panda paracetamol at hand, I get to spend more time with my little girl.
Feel good, get better. with Panda Paracetamol.
Feel better with Panda Paracetamol, another quality product from Afrap Chem Limited.
Welcome back, viewers. We would like to take more questions so that Dr. Gbemisola can attend to them and enlighten us more. A reminder, please share this video so that more people can participate and join us and also get enlightened about malaria, as we have the consultant pediatrician here with us. Doctor, I have a question coming in. Doctor, is catarrh and cough, I didn't get this question. Can catarrh and cough be a symptom of malaria, I guess? The question is not so clear.
Yeah, I guess you want to know whether a child who has catarrh and cough can also actually have malaria or could be symptoms of malaria, which already I've answered that.
Yes, you have.
Malaria, you could have anything really. Of course, cough and catarrh, malaria may not be the first thing we think about. Of course, we think first acute respiratory tract infections, which could be viral and all that. But sometimes we know that with malaria have any symptoms. So if the child is really very ill, then most doctors will still run the malaria. Yeah.
Thank you, Doctor.
So while we're waiting for we just go on and talk about how do we treat malaria. Luckily, malaria drugs are readily available. But these days, we have moved away from a single drug in malaria to using double drugs. So it has to be what we call a antihistamine-based combination therapy to treat malaria. In other words, you can't just use only one drug to treat malaria. So what is recommended, what the national guidelines recommend for treating malaria is what we call antihistamine-based combination therapy. And most of those drugs are already sold as a combination. So you have either artemisinin or camoquine, or you have artemether, lumefantrine, and all that. But once in a while, you see some people selling the single drugs. You say so. People sell Fancida, people sell Lafan, people sell camoquine, and they sell them as or chloroquine as a single drug. And you see mothers using those medication as what we call monotherapy. That is actually wrong. And so if you're going to treat malaria, interestingly enough, anti-malarials are drugs that you can buy without doctor's prescription. It's available because sometimes mothers just have to treat malaria because we have malaria so common here. But as much as possible, we want us to test. Make sure the child has confirmed malaria before you start using the anti-malaria. And most treatments are actually for it. But make sure you give the drugs, the combination, it must be the combination drugs, 2 drugs at once, and you must complete the treatment. Because that's another thing mothers don't do. We don't complete the treatment for the malaria, and when we don't complete it, the parasite is just, you reduce it a little bit, but it has not been completely cleared out of the system, so it can come up again. Maybe that people say, oh, my child is having recurrent malaria. Sometimes people don't treat properly. So you make sure you give the drugs, and the time is also very important. So if we say give the first dose and repeat 8 hours later, don't just do it any time of the day or any time you like. You have to make sure you maintain, you keep to the timing. I know it could be very difficult, but sometimes it's just for 3 days. So try and maintain it. Yeah.
I think despite the fact that malaria drugs are what we can buy over the counter, you mentioned a very good reason why we should get to the hospital and get a doctor's prescription so that we can use the right drug and get the right prescription. So despite the fact that it's an over-the-counter drug, it is still better we are at the clinic to get the doctor's prescription. Doctor, I have another question here from Judith. She asks, good morning, doctor. I noticed that my baby's diaper is not that wet, but it's not that wet, but he really didn't wee this morning too. He's 4 months old. And again, I've treated him for malaria last week, but with this cold weather, my baby, I can't get the continuation of the question. I think
And
she's
Judith, I think
saying,
you need to take your 4 month old to the hospital. Please don't treat 4 months old by yourself. Don't do self medication. I personally don't even like mothers treating children below. I mean, below 5. I would rather you just take. And a 4 month old is still a very small baby. That not I won't. You are not. I will. I'm not comfortable with you making any diagnosis or making any treatment. I don't know why you are treating a 4 month old for malaria. Seriously, most of them don't have malaria before 6 months. Reason because the if you are breastfeeding exclusively, especially, and you are a mother from Nigeria, you have partial immunity against malaria. You are getting your baby against malaria. And I expect that your baby should be sleeping under net. So your baby should not be a 4 month old should be mostly indoors, sleeping under net. So malaria in that age group is actually very rare. And so if your child is ill enough, not making enough urine and all that, that child needs to see a pediatrician. That child should be taken to the hospital. And I always will keep re-emphasizing it that I appreciate mothers being home doctors and all that, but we should also know when we need to drop our home doctor cap and take the children to the hospital, because yes, it's a very important thing. It's something I'm very passionate about, because there's nothing very traumatic to a pediatrician than seeing a baby that you could have saved, but because the mother came at the last minute and you just watch that baby, there's nothing you can do. And in Africa, we get a lot of late presentation. A child has been sick, the mother is just doing her own thing, 1 day, 2 days, 3 days, 1 week, and then they will come to the hospital expecting the pediatrician a miracle. We can, but if you be on day 1, 2, I will likely be able to help that child better. So for your babies especially, don't waste time. 1 day, 2
to the
days,
hospital.
take them to the hospital, please. And a child who is not making adequate urine, I'm very worried about that child. So please, I will even say don't finish listening to this program. Start arranging your bag and start going to the hospital now. It's better to go to the hospital and we say, oh, why did you worry? There's no problem. Than for us to say, oh, why are you just coming now? We are very, very sorry and all that. You understand? So please do the right thing. Thank you.
Thank you, Doctor. Please, viewers, when you're sending in your questions, please send, if it's more than 140 characters, please send as a second message so that we'll be able to read up. I have another question from Viv. She asks, please, doctor, what are the symptoms of malaria? Yes, you've talked about this. Probably she wasn't online then. What are the symptoms of malaria,
Yeah.
Doctor? Could you please briefly take that again?
Yeah. What I would just suggest for those who are joining us, if sometimes we may have said some of the things you are asking again, please at the end of the program you can just go back and watch the entire video all over again so that you can get all the information.
Right.
We appreciate you for joining us. But for V, common symptoms of malaria: fever, feeling of unwell, what we call malaria, and poor appetite, weakness, and sometimes some children could have vomiting, sometimes they could have abdominal pain. In fact, they could have virtually any symptom. And if it is severe malaria, you could have other features. For example, a child with cerebral malaria who have fever, then go unconscious. And those ones their life-threatening situation in hospital. Some children who have fever have convulsions. You have to take them to the hospital. Some children can have fever and they will start passing bloody urine or dark-colored urine, or their urine reduced. That is a sign of the kidney getting involved in that malaria hospital. Some children who have malaria and their eyes will turn yellow. You have to take them to the hospital. So when you have some children have malaria, they are so weak they cannot carry themselves up until they can't even this process. Those are severe malaria pictures that need to be taken to the emergency room. You in those instances, yeah.
Thank you, Doctor. Okay, we have Obioma saying, very educative, self-medication is dangerous and should be discouraged. Kudos, Doctor. This is someone appreciating you, Doctor. Thank you, Obioma.
Obioma, thank you for supporting the campaign.
I think really with more awareness, this will get across. People just feel when a child is having fever or a child is unwell, not playing as usual, it is malaria. And I can always get to the pharmacy or to the chemist and buy any drug I want. But I think with more awareness, people are getting it right. More questions, viewers, so that Dr. Gbemi, they can attend to them. Okay, we have a question from Vera. Good morning, doctor. Is it possible for a baby to have malaria without temperature? I think you said something about that. But...
Yeah, thank you, Vera, for your question. Yes, we've answered that before. Fever is very common in malaria, yes. But once in a while, we can have that. And to be honest, sometimes children can have the opposite of fever. They can actually have low temperature, like I mentioned the last time. So even though fever is the commonest presentation, you could have anything. So if a child is unwell, mothers are very good with their intuition. They always know when the children are just not well. They just know. They just know something is wrong. They may not even be able to explain it. And I always say, trust your intuition. Instinct. I always trust mothers. If a mother, even if a mother tells me as a pediatrician that there's something wrong with my child, and I look at that child, I don't think anything is wrong, I'm still going to trust that mother because she knows her child better than I do. I will keep an eye on that child. Maybe I will watch. You understand? So if you think there's something wrong with your child, you don't even know what it is, please take the child to the hospital. Don't mind the pediatrician that say, why are you disturbing us? There's nothing wrong. It's better you go there and we reassure you than for you to come later and we say, oh, why are you just coming now? So you should have that your intuition or gut feeling that there's something wrong, just take the child to the hospital.
Okay. Doctor, when laboratory tests are done, there's this malaria plus, malaria double plus, malaria sometimes triple. What difference does it tell the amount of time the parasites have been in the body or what degree?
Yeah. Okay, yes. Thank you very much. I think it's very important because mothers sometimes get worried. So the laboratory scientists are just trying to tell us what we call the degree of parasitemia. In other words, how much of the malaria parasite. And if you have so much of the malaria parasites, what we call a very high degree of the parasitemia, 3+, 4+, it's also very worrisome because it means that those malaria parasites have multiplied so much in the blood, and that is also like something that we should treat as an emergency. So that child really, sometimes for those kind of people, we treat them like severe malaria. Now, the difference between severe malaria and the uncomplicated or simple malaria is that the way we treat it is different. So if it's simple malaria, you can take your tablets and that will be fine. 3 days, you're okay. If it's severe malaria, we need to admit you to the hospital. We need to give you your anti-malaria as an injection or preferably something into the vein, intravenous anti-malaria. So we are more aggressive about it. And because, so the lab scientists just helped us, and I found out that a lot of the time, depending on the lab you are using, some people just write 3, 1+, they always see malaria. So I remember that you are living in malaria endemic area, so we don't treat lab results. I always tell parents that, because just like some others have asked, some others just go and test malaria even when the children are well, and then they will say there's 1+ or 2+, then they want you to treat the child. Yes. We don't treat a lab test. We treat the child. So if your child doesn't have malaria, the child is playing, is happy, is eating, is no fever, even if you come to me with 1+ or 2+, I'm not going to treat your child for malaria because obviously that child doesn't look like he has malaria. And lab tests also depend on the expertise of the people who are doing this. So there is what we call the rapid test, which anybody can do. Then there's the gold standard test, is what we call the film, where we actually look under the microscope, and that's actually done by trained scientists who know how to look under. Yes, who can look, not technicians or scientists, who can look under the microscope and tell you and count. Yeah, the medical laboratory scientists who can count and tell you, yes, this is malaria and all that. So because the rapid test to have false negatives, to have so that is that, but it's good that at least we have an idea. But if we are not sure, we can now go and do the diagnostic, the gold standard test, which is the microscopic identification of the malaria parasite itself. Yes.
Okay. Thank you, doctor. Let's have your questions rolling. And please remember to share on the group. Yes, we have a question from AMs. Besides the fever, should anti-malaria be given to children every month? You've answered that.
Okay,
No.
I think I've answered. I think I'm going to go and put a post. I think I've done that before, but maybe I can do it again. Please stop doing that. There are mothers that do that, and I'm happy they are asking the questions. Don't treat your children for malaria every month. Don't even treat them every 3 months. Don't treat them at all. That's because you are going to create a lot of issues for those children. Let them develop the natural some partial immunity against malaria. So treat only when they have malaria symptoms and confirmed by laboratory. Don't just treat
Malaria
anyhow.
randomly.
Yeah.
Thank you, doctor. Let's have your questions rolling. More questions.
I think we have one question just now.
Okay. More questions.
So while we're waiting for the questions,
Okay.
no problem. While we're waiting for the questions, let me just summarize again. Malaria is quite endemic. A vaccine yet, but people are really working hard to see whether they can give us malaria vaccine very soon. But in the meantime, let's focus on prevention of malaria, and then let's focus on treating malaria as soon as possible so that it doesn't develop to severe malaria. And if the children are developing what looks like severe malaria, then you need to quickly get them to a proper hospital, preferably a teaching hospital, so that the children can be treated. Because malaria kills. Malaria is still one of the highest killer of our children. That's why we are talking about it. So even though it looks like simple malaria, but malaria can progress very rapidly in children and it can lead to death. So we need to be more aggressive in making sure we prevent our children from having malaria.
Thank you. We have a question from Tolu Lope. She asks, my kid says it's possible for kids to go off for a year without having malaria. So no need to treat malaria routinely. How true? I'm sure you
It's
answered
true
that.
now. We have said that already. Yes. We have said that to Lulokwe. I guess you are just joining us. Yes, children don't need to have malaria. They don't have to. And you don't need to treat them as well if they don't have malaria. So we are all on the same page. Yes.
And I think because it's even a pediatrician saying that, we should trust them more. They know better. I also want to ask Doctor, how early, from what age can the insect repellents be used on children? Can it be used for babies?
That depends on the manufacturers of the. But usually we want to avoid them in babies below 3 months generally.
Okay.
Because depending on the kind of chemicals that are inside and all that, so you really want to be careful. So you don't have to use. I personally don't like reusing them. I prefer you use because some of these chemicals gets absorbed into the baby. A new baby skin is very
Tender.
thin and it can easily absorb so many things into the bloodstream, and which can create other issues, allergy and all that. So I'm more comfortable if you put those babies under the net. An average 1 month, 2 months is the most time they are indoors, they are not going anywhere, at least we hope. So usually at home, just keep them under the net, they'll be fine. And make sure your house is well protected against malaria. If you need to fumigate before the babies arrive, do that and things like that. Yeah.
Okay, thank you, doctor. We have another question from Hanu. She asks, can I treat malaria myself for my kid since the symptoms are same?
Yeah, I know we have answered that question. I understand where this questions are coming from because there's a time that we doctors actually encourage mothers to treat malaria. In other words, if your child has fever, just as anti-malaria. But we have started moving away from that because of the resistance I was talking about earlier. So these days we are moving towards confirming malaria first before we treat it. So if your child has fever, please let them have a laboratory test done at your private hospital or your clinic or health center. Most of them can do those rapid tests for malaria. Once they do it and it's confirmed malaria, then of course you can treat the malaria. You can actually treat malaria by yourself. It's like I said, it's something you can buy over the counter, and it's very simple. They've made it in packages where, based on the age of your child, this is the amount you use. This is based on the weight of the child. This is what you use. We try to empower parents to treat malaria, but we are trying to now say, please, can you for confirm malaria first before you start treating it? And please don't give them anti-malaria like routinely, and don't give them daraprim, don't give them all those preventive malaria medicine. We don't recommend that anymore.
Thank you, doctor. Hanu is asking again, doctor, I treated my baby for malaria last month and she's down with fever this morning. Should I repeat the treatment given to me last time I visited the hospital? I think it's in relation with the initial question she asked.
Okay, we now get your question. Okay, so this baby has the same and let them, and sometimes when children have some symptoms recurrently, it's a pointer to something else entirely. It's a pointer to that there's another problem that we have not even discovered. And it is when you go to the hospital that doctor will like, wait a minute, this child was there last week for malaria, for fever, is there again for let them check the child again. Don't assume.
Oya Hire is asking, can constant runny nose be a symptom of malaria?
Very unlikely. Constant running nose is usually what you get in children who have allergic rhinitis, or they have other maybe adenoids and stuff like that. So some children have those allergic conditions that make them